Well, expected tomorrow in Lincoln, floor debate on a bill that would expand the Medical Cannabis Commission's authority. The new bill goes beyond dispensaries and growers to include patients, caregivers, and doctors. If passed, patients would have to register with the state. They would also have to pay a fee to legally have their prescription. Doctors would also need to enroll in a state program and follow commission rules to participate. And Nebraskans who have gone out of state for a recommendation would lose that option entirely. Supporters say it gives the program some structure. Critics say it strips away protections patients already have.
Is a very narrow bill that only addresses the Cannabis Commission. It allows for commissioners to be paid. It allows for the commission to raise fees, and that's important for them to be able to do their work. But it doesn't do a lot to ensure that patients and families are going to get access to the cannabis that the voters approved.
Kavanaugh has been pushing a separate bill, LB 933, to give doctors legal immunity when recommending cannabis as long as they follow the law in their training. That bill cleared committee this week and is now headed to the full legislature.
Nebraska's Medical Cannabis Commission held a public hearing on newly proposed emergency regulations today. Jim Elworth was the only commissioner present, a slight improvement over the last hearing, which none of the commissioners attended.
Seeing a commissioner be here in attendance to hopefully hear those stories and put faces with those names, I think that's incredibly encouraging. And I hope that's what continues. I hope that we see engagement and interest and truly some compassion is what I saw today with that.
Changes in the proposed emergency regulations include in-person appointments for patients looking to receive a doctor's recommendation. Advocates fear this may be a barrier for some rural or disabled patients who don't have reliable access to transportation. Another concern is the cap on THC. The new regulation would allow 5 grams of THC to be dispensed every 90 days. Commissioners will review today's testimony, but it's not clear when those regulations will be voted on.